All right, guys, now we're going to jump on to our second guest, and this beauty of a gem is another returning guest. I'm so excited to introduce for the second time, Hillary. Hey, girl, how's it going?
Good. How's it going with you?
I am so good. Thank you for coming back to our show. Can you let us know how you feel after the first time you came to our show?
I had so much fun talking to you guys. And it just felt really good to be open about that journey that I was on. I shut it off from pretty much everyone except people who were really, really close to me for a very long time. And I've had people reach out since that episode launched. And I feel like it's reached people and made them realize, like, oh, I'm not crazy for feeling these things. And that makes me feel so great that I was able to help even just a handful of people just to share
Isn't
my
it such
story.
an isn't it such an incredible feeling? You're like, wow, I didn't realize that me just like stepping into myself, who I am, owning my story, and just talking about it. And I love when people are like, oh my gosh, I can't believe you're doing this. I'm like, everyone can do this.
Yeah,
Everyone has the opportunity to share their story and help someone, even though you think there's no way. There's millions of people in the world. There's tons of people that are going to relate in some way, or maybe not now, maybe down the road they go to those moments and then they're pre-equipped with your story, and it's like a ripple effect, and it's just so cool to watch it because this is exactly what we wanted it to do.
exactly.
And to hear back like you and all the other girls be like, oh well, now I've had people reach out to me, and now that's going to start a dialogue with that person that maybe you never had, or reconnect you with someone from your past, and now you have that other friend, and then you share memes, and it's cool. It's such a cool way to connect such a disconnected world right now, I think.
It is. And it like people that I wouldn't even think would listen to this podcast reached out, and a couple people reached out in regards to therapy. So like people are actually taking steps to do better for themselves after listening. And that was such a good feeling.
Oh, I'm gonna cry. And we're the same way because when we first started this, we actually started the Instagram, and we're like, okay, I was gonna leave it private, and we were just gonna launch with just like our friends, and that was it. We were gonna keep it super private, and I don't know where my brain was at, but I forgot to put the Instagram on private, and all of a sudden there was like 30 followers, and half of them I didn't know, and I was like, oh shit,
Panic,
oh shit.
panicking.
I can't. Yeah, I was like, I guess I can't go back now. And I was like, hey, I guess we're going public with this.
Yeah.
And I kind of had this like thing with numbers in a sense where it's just like, okay, if we hit 100 people in a month, if 100, even if it's the same people, but if we had 100 views, that would be insane. And now we're nearing 450. Yeah. And that's just on the podcast platforms. When we flip over to YouTube, we're going around 200 to 300 in that area too. So for over 600 times to have our stories and your guys' stories viewed is just shocking and incredible. And we wanted everyone to have those feel good feelings. And that's all we're hearing back. And that's absolutely incredible. So I'm really glad. And I hope this inspires other people to have any topic that they see to jump in. And I knew you would be good for this one because we talk about this one quite a
Yeah,
bit.
we did.
And you're very recent in your journey, as well as I am. And so now it's like a couple years in for me, and I'm really seeing the positive effects of being more natural. And so I'm really excited. When we talked about this, you're like, we're going to talk about birth control, right? I'm like, oh yeah.
Oh, hell yeah, we are.
Yeah. And I definitely thought this month we would call it women's health, but now that I broke it down, this is actually going to be more of like a women's reproductive health. We'll get into other health later, but this is like the beginning steps to us, where we think for us personally, most things started happening with our lives because of the birth control started at certain times of our lives.
Mhm.
So let's lead into that. Hillary, when and where, let's try that again. Why and when did you first start birth control?
Honestly, I started birth control very early. I think I was like 15 or 16. I remember being in high school, and the girls that I was hanging out with were also on birth control, and I just felt left out, and that was literally my only reason for starting. And it's such a stupid reason now that I look back, and I just want to be like, oh my God, you stupid bitch, don't fuck with your hormones just to fit in with your friends.
Yes. But you don't know at that time. And you think too, you're like, oh, well, I mean, wouldn't it just make sense? I mean, it's safe. So if I just go on it, then when I have sex, I'm already safe. I don't have to worry about it. And like for me, my mom had kids again, and so did my dad when I was 12. So there's babies everywhere. So I was like, I really don't want to have a baby.
No.
So to me, it was no fucking brainer. And then there was no, oh, hey, if you take this, just so you know, it's going to mess with your hormones. And I would have been like, what? It was like, no, it's safe. It's good. This is the right way to do things. You're like, okay, well, the doctor or the nurse at Planned Parenthood, whatever the fuck, the clinic, whatever it is, it says it's good. So everyone else is doing it. And like you said, I started smoking cigarettes because everyone else was doing
Me
it. So
too.
don't worry. I get you. We do
Oh,
that. And if it's safe, then why wouldn't you? But
exactly.
alas, is it completely safe? We don't know. We don't know.
No, we really don't. We still don't, but
No, no. And I mean, and I guess it's said for everybody that it's going to work different, right? Again, just like with all of our episodes, we're never going to tell you what to do. If medication works for you, do it. But I think for us, it's more informed consent
exactly.
with anything.
Yeah.
Anything that you go to do, that's fine. I'm not going to judge, but as long as you know what the risks are the risk worth the reward? As a teenager, not having a kid and being a little hormonal, probably worth it. Now in my adult life, where it's like I'm not a horny teenager that's like trying to prove something all the time, so it's like, oh, we're ovulating, let's not have sex or whatever, or
Yeah.
just back up in the next
I knew
couple of days.
nothing
Like,
about cycle tracking when I was younger at all.
no, no, I thought I was like just dying halfway through the month and I was just being punished for being a woman. And now I'm like, oh, you're ovulating.
Perfect.
Fantastic. Cool. That's why you're this way. Okay. Yeah. Let's definitely. Right. But then if you're 16, you're killing your ovulation. Right. So
Exactly.
reading, I don't know if you read this at all or if you knew it. I didn't know until I started diving deeper into this, but it actually decreases your libido. Obviously, like another form of birth control, you don't ovulate. So therefore, you're not as horny. So I know there's a lot of women that I know that have always questioned what's wrong with them and why they don't feel that way, or you know what I mean, or they struggle that way. And it's like, well, you're literally taking something that's suppressing that.
Yeah, that's
There's
actually
nothing wrong with
my
you.
like number one symptom when I was on hormonal birth control. Is like I didn't want to have sex and I was like, is this how it's supposed to work? Is this just how I
Yeah.
don't get pregnant? I just don't want to have sex ever.
Yeah. I just don't. And it's just not okay. Well, making me just abs. And then that's the frustrating part because then you think it's you
Yeah.
and there's something wrong with you.
Yep. I definitely
And
thought I was broken. I was like, something's just not right. Like there's no way that
yep.
every person around me is like crazy about having sex and I'm like, meh.
Yes. Totally get that. And you're like, okay, cool. And then like, these are the things I wish they would have discussed. Not saying that I wouldn't still take them or think that they're right, but at least you can understand that that's a side effect or a symptom of what you're taking and not you thinking, okay, I'm broken. And if that's not worth it to you and you rather do a natural route or and be in tune with your body,
Mhm.
that's nice to know that that would have been a fucking option.
Yeah. I mean, I was lucky when I was younger. I wasn't on birth control for very long. The
Okay.
symptoms like were kind of just really annoying. I spotted all the time and my boobs hurt so bad. So I just stopped.
Fair. That's totally fair. That's smart. Do you remember what kind you're on or what kind you've been on in the past?
Um, hmm. I think the pills that I were taking was like tricycline low.
Yeah,
Yeah.
that's so funny because I was thinking, man, I couldn't think it. And I started researching the names. I'm like, what? And then as soon as I read tricycline low, I'm like, that one fucking right there.
Yeah, those
That's one of them.
just brought back memories saying that word.
Yeah. It's like feeling like 16 all over again, sitting in the clinic going, what the hell's a pap test? What does this
Yeah,
mean? Oh my
right.
God.
I
What are they
was
going to do?
kind of lucky in a sense that my mom worked for I actually don't remember if it was like for a hospital or for like just a doctor's practice, but she brought me some samples. So I like didn't have to go through that process, which I mean, I hope I don't get her in
Nice.
trouble by telling this, but yeah, that's how I got on it. I just talked to my mom. I was like, I think I want to go on birth control. I mean, I was with my very first boyfriend, the love of my life at the time, and I was like, I didn't want to tell her like I want to have sex with this guy, but I was just like, I just think that I should just be on it because everyone else is on it, and she's like, oh my God. I think it was a thought to her like, teen pregnancy, no.
Yeah, well, and then too, again, they don't know any different, and that's just the new thing that, again, the doctor's not saying that it's wrong, are saying it's safe and da, 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 and it is for some people. Like Kayla's mother-in-law, she has been on it for 50 years and no side effects, where some people it just wreaks havoc on them, and depending on what
Right.
kind. Like I tried the pill and the pill made me crazy. It made me my cramps worse. None of it really worked. And then I went on the patch and then I got a blood clot from the
Oh my
patch.
God, that's actually my
So
biggest fear. Did we talk about this in the anxiety episode where I always think I have a blood clot and I'm dying?
yeah, that's a real allowed
Oh.
fear. I've been through it. Yeah, I had to like go through all these samples, and turns out it was like because I was trying to find alternatives, and I wouldn't do the shot because the thought of having that in my body for 6 months to a year made me sick to my stomach. So I was like, what if it doesn't, like everything other birth control I've had has been bad
Mhm.
for me. I'm not going to inject myself with something that's going to could be potentially a year in my
Yeah, the
body
thought of
with
not having
adverse effects.
control over the intake, that no, not an option.
Yeah. No. So I was like, oh, the patch. And then I ended up getting a blood clot and being super sick. So then I just went off completely for a
Hmm.
bit. And then, yeah, I went back on birth control off a very low
Yeah,
hormone dose. I think it was called Yaz. It was like off of the Yasmin or whatever, which way it was, but it was like super light. It was supposed to be for acne, of
right.
course, too, which neither of it did, but it was fine in my 20s. And that was fine. But natural tracking to me is like the way to
I
go
also
now.
tried Yaz when I was younger, but same thing, like the same symptoms, just constant spotting, constant
Mhm.
achy boobs. I was not having it. I was like, okay, well, that's
So
it. I'm done with that.
yeah, and you're just like, this is not great. I don't love this. I'm getting the side effects aren't worth it. Like I said, if the risk isn't worth the reward, then like, or vice versa, if the reward isn't worth the risks, like, then yeah, teen pregnancy probably wasn't great. It would have been nice to know, but now for me, it's like I'm an adult. I can just communicate with Grant. I have an app that tells me the blue times mean it's when we're gonna get pregnant. So I'm like, hey, no
Stay
blue
away from
times
me.
here. Yeah, I'm like, don't even look in my direction. Go sleep in the other room. Just kidding.
Just have pillow
But
barriers.
yeah, exactly. And I feel so much more empowered too, because like you said, I wish your cycle means so much. Like this morning I woke up, I was like, same thing. My boobs are just killing me. I'm like, oh my God, I'm pregnant. It's the first thing I thought. And I'm like 5 days from my period on my thing, on my tracking. And I was like, oh,
Okay, perfect.
okay.
This
Yeah.
is normal.
Perfect. This is normal, instead of me all day being like, oh my God, I'm pregnant. Like, it's just so nice to be so much more in tune. And I don't know if other people feel this way, but I personally feel I'm more in tune with my body and can call my hormones out on where I am on my cycle, or know if it's environmental or whatever. And that just helps me kind of like identify things and feel better
Yes,
about
since I
them.
started tracking, I don't feel crazy. PMS makes me like my fuse goes to zero. Like I have no patience. Everything makes me want to freak out. I want to throw things. And then I use the app Flow and I check Flow and it's like
Me too.
6 days to period. I'm like, oh, okay. I'm not a psycho.
Yeah. Or when you're like keeling over and you're like, oh, why am I getting my period? I just haven't had look and it's like 3 days to ovulation. And you're like, oh,
Perfect. Things are
great.
just
Okay.
doing what they're supposed to.
Yeah, and that's just natural of my body, and it's not something that it's in my, I don't know, I just feel like once I can call that out, it's like easier just to like not let it go, but just kind of call it what it
It
is,
doesn't
like,
just sit in
okay,
the
well,
back of
it's
your mind
this.
like,
And
oh God, this is pregnancy.
yeah, or something's wrong with me, or like what's pissing me off and I can't identify it, so then you're searching for a reason, but there's no reason. It's just where your body's at right now. And I wish that we would have had that knowledge earlier in 20s and teens. I mean, whatever, maybe it was out there but we didn't absorb it, but I wish I would have, because
I actually
man.
don't even recall learning this stuff in any kind of sex ed class that we had. Now that I'm
No,
thinking
it's
about it, we
condoms
just
and
learned about like the diseases, pregnancy,
abstinence. Yeah.
but nothing about cycles or hormones.
No, not at all. And how it affects everything. And like even to that, like eating and how
Yeah.
that affects that. Like none of that is ever talked about, which I think is super fucking wild. And I think it makes a world of a difference. So I'm glad we're all talking about it now, because I don't know about you, but my life has changed so much when I've identified all these things that attribute to my hormones that, besides
Yeah.
emotions and
Yeah.
feelings,
I actually never
right?
thought about that
So
until
that,
right now, never learning about this.
right. And this is what I started to a couple years ago, because I just couldn't go back on birth control after I had a miscarriage. It was like so much throes of emotions up and down and hormones, and I was like, I think my body just needs a
Yeah.
reset. Like, and I just looked at Grant, I was like, I can't do this anymore. Like, I can't put my body through this after like 20 something years anymore, just so that we can have, we don't have to like be mindful of when we have sex or
Mhm.
whatever. Like, and he was right on board with me. And I think that's so commendable. And I inspire other men to have these conversations with their women, because a lot of the time we're doing it to make you guys happy
Yep.
too. And I don't mean that in a rude way. But it's just easier for a girl to take a pill,
Oh,
right?
what's that
But
meme? It's like,
if
is your girl crazy or is she just taking a pill so you can get an extra couple pumps?
exactly. And I'm not saying, like, I get it. I totally get it. And I can understand, because I was the same way, especially it's easy when you're in a long-term relationship like we are to say things are easier when single, for sure. But that being said, like, especially if you're in a long-term relationship, if that's affecting your woman and it's affecting your fucking life,
Yeah.
let's be honest here. Um, have that conversation of finding alternative motives or other things, so that she doesn't have to go psychotic on birth control
Yes.
pills for that, right? It's just, it was so pushed on us as children, and I never realized that until I was older. Not children, but pretty much.
Basically children, like
Um, yeah,
mid-teens.
yeah. And it was, and the same thing to me. It wasn't even pushed that I was starting to have sex. It was like, oh, your acne, oh, your cramps for your period. Like, it wasn't that, and it was like, oh, and then if you start having sex, well, then it's just proof
Yeah.
if you're on it. I was like, what? What? Why don't we talk about what I'm eating? Maybe that's why I'm having bad acne. What about my cycle and where I am and what I'm eating? If I eat more dairy and hormonally packed food during my period,
Figure out what hormones are
probably.
spiking and causing breakouts.
Exactly. So, like, learning what you're eating in your body, in your environment, all those things. I have had I've had my breakout. It was a really bad year after. I don't know about you, but it was a really bad acne breakout the first year and a bit after coming off of birth control. And then the mask didn't help, and the
Hmm.
stress at work. Now though, it's clearing up, and it's because I'm thinking about what I'm eating, and when I'm, actually sticking to, found a like kind of routine that works for me, sticking to it, hydrating, doing the things from the inside too, and not just, yeah,
I feel
I
like
don't know.
I've been
They never taught
lucky
that.
in that regard. I haven't, I never had the acne or had to worry about what I was ingesting that would cause like flare-ups or anything. But um, yeah.
But it would be nice to have that
Yep.
discussion, right? And I'm sure, like, for when we talked about with the anxiety, and I'm sure, had you done the depression, you'll probably attest to that. If you're eating like shit too, that doesn't make your mental health
No, just throw
situations any better
gasoline on the
either.
fire.
Yeah, and it's the same thing, I think, when you've got the hormones and you've got them all over all coming, all radical ones coming from all
Hmm.
over the fucking place. No wonder why our bodies are like
Right? Just in a constant
and
state of
just shit
mayhem.
all the time. Yeah. So what'd you say right now? Obviously that you're just naturally tracking your cycle. That's the form of birth control you use the most
I
currently.
actually have a copper IUD right now. It was the only hormone-free
Oh, cool.
option. Um,
Nice.
I knew that I needed birth control. Just with like the things that
Yeah,
Matt and I
of
have
course.
been through these last few years, there's just being not being on birth control is not an option. So I
Yeah.
was on the hormonal IUD for the last probably like 3 and a bit years. I got it taken out in the summer. Um,
Nice.
so yeah, what I'm on right now, copper IUD, I did not want to go back on the synthetic hormones and I refused. And two doctors told me like this one's not going to be good for you. The periods are worse. Gave me the list of reasons why I should not be on hormone
Yeah.
free and why I should go back on the hormone IUD. And I was like, are you not hearing me? Like, I do not want these hormones in my body anymore. Like,
They
right?
don't
I was
listen.
off of the hormonal IUD for probably half a year. And I finally felt like I was coming back to myself and like thinking how I normally do. And like my sex drive was back. And then for them to just be like, well, no, I don't think it's from the birth control. I think you should go back on the hormonal one. I was like, am I like fucking going crazy? Is no one hearing me?
Oh my gosh. I find that so frustrating. Like, at what end? Like, why is it always such a push for this synthetic hormones? Like, why can't we just let our bodies be natural for a while, especially when your patient's sitting here telling you, I'm feeling the best I ever have?
Exactly. But
I
I'm
don't
glad that I actually
understand.
have
I
the
don't understand
backbone
that.
now. Like at 30 years old, I was like, no,
Yes,
this is what I'm getting. And like, if you're not going to give it to me, I'll go somewhere else.
exactly. Exactly. And that's the thing. I think for the longest time, a lot of us get trapped thinking that we only have one doctor. No, if that doesn't work, go to another one, find someone. Just because like, think about all the people that professionally or not, that have different opinions from you. There's going to be those people in the medical system, and not to discredit their knowledge, But, you know, there's right now too, we talk about like, even if you're talking like on high end vaccines and masks and all that, you have people on both sides that are equally educated
Hmm.
and have different opinions. So when you break it down to stuff like birth control, everyone's going to have a different opinion on the bias of their experiences. So just because one doctor is saying, yeah, this is good for you, doesn't necessarily mean that that's your truth. That's just one
Exactly. And I was
opinion.
like, I listened to you like 3.5 years ago, and that's why I'm here, like not wanting synthetic hormones. I did the hormone IUD and it was not for me. I gave it 3 years.
Exactly.
That is more than enough time to know that
Yeah.
I fucking hate it.
Yes. And even if it was a couple months, it's your body, it's your choice. It's not like it's going out of their way to do that. You know, you book a surgery, you do it. That's your life, your job, even if you, or not job, but like that the job's going to get done. It's not like it's going to affect the doctor's life whatsoever. I never understand why they
Exactly.
push
Like,
for
as
stuff.
soon as I leave
So
this
then,
office, like you have nothing to do with me. You don't, know the side
yeah,
effects that I go through. And like, even if I was to share, it's like, oh no, I don't think it's from that. I think like maybe it's just something else. And I'm like, oh, okay, you're right. Yep, sure.
okay, sure. You are right. So how would you say that birth control has either positively or negative? Like what are both positive and negatively affected you in your life? We like to
Um,
see both
so
sides.
negative, I mean, I feel like that list is longer, so I'm just gonna start there.
Yes, that's
Obviously we just talked about the side effects. They were shit for me. Like, on the pill, just constant spotting, achy boobs. And then with the hormonal IUD, the side effects were so bad, dude. Like I it got worse over time. Like the first year was kind of great. My hormones were kind of leveling off from an incident that we had. Um, so the first year I was kind of like, well, maybe it's not actually the birth control. Like maybe I'm just kind of leveling out. And then 2 to 3 years,
okay.
side effects really started to set in, and I'm like, okay, this isn't normal. Like my moods were so, just leveled out. I never felt, like super happy like I used to, or like super excited, but I also didn't experience the super lows. Like if something sad would happen, I would be sad, obviously, but it would be like I'd have to force myself to cry almost because I'm like, meh. It's like, okay. um,
You were just kind of disconnected almost like to any
Very
emotion.
disconnected. Um, and then physical, like I started to put weight on in my lower stomach and it wouldn't come off. Like no matter how hard I would
Mhm.
diet or work out, it was just always there. Um, which I thought
Yeah,
was on purpose because during that time I was trying to put weight on. I was trying to put on muscle mass. So I was like,
very,
oh, maybe I just have to be a little fat to get some muscle. Um,
yeah.
and then other physical symptoms were like interfering with our sex life. Like I would have chronic yeast infections. And I had never, ever, ever in my life had one until I had this IUD. And I'm like, okay, come on. Right.
That's
And I'm
wild.
like, there's no way that it's
Hmm,
not from this. And I would tell Matt, and he's like, well, maybe it's
totally.
like the diet. Cause like, like I said, I was trying to put on weight. So we were eating a lot. I was like, he was like, maybe we're just not eating the best. And the doctor would say, like, well, same thing. Maybe it's the diet. It's, something you guys are using. I'm like, it's
It,
not though. Like, you guys, I swear it's from this fucking IUD. Like, I knew. And
it's not something unnaturally implanted in your body. It's something that you've been doing your whole life essentially. Yeah, maybe eating more food. Okay, kind of. I get that. But I'm sure at one point in your life you ate a lot of food. You're a competitor. At some point you've eaten a lot of food too.
right.
I mean, if you dialed that back and it didn't work after a month or two, like I just love how everyone tries to put it. It's like, oh, it's your diet and your exercise. And it's like, oh, sure, it's not something that's unnaturally planted inside of my body
Exactly.
with
So
hormones.
I started
Nope.
doing a lot of Googling,
It's
and the IUD I had synthetic progesterone in it. And just doing some Googling, and it was like high progesterone can lead to like yeast infections, low libido. Basically, every symptom that I had, I'm like, gosh, how much more obvious can it be that this is what it is? Um,
how how'd you get that? And people say don't Google it, but it's like, okay, but my doctor can't even fucking do a
I
Google and see
know.
that this is
But I mean,
wrong.
I just Google everything and my doctor gives me shit for it anyways. Like, I'll go in and be like, I think I have MS. She was like, oh, no, please stay off Google. I'm like, are you sure?
Not this again.
Like, you didn't test me. You don't know. Um, yeah, so I just did a lot of Googling, and with high progesterone, I actually, and I'm just gonna say, like, I don't know if this is all factual. This is from the internet, okay? High progesterone
Yeah,
means
I
low
did that too.
estrogen, which would be why I had no sex drive, and like I was like, okay, it's like time for this thing to come out. And it was time for it to come out anyways. So I got it taken out and I was like, I think I just need a break. Like, I don't want another one of these put in. And that's when the push was like, oh, it's fine. It'll be whatever. And I was like, no, like, I don't want anything, like nothing. I just want to be completely natural.
Yeah.
Um,
Yeah.
and then fast forward 6 months, I'm like, hey, it's probably time because things are getting a little dicey. Um,
Yeah.
you check the app and
It
it's
gets
like, well, I mean,
nerve-wracking
I'll
for
be like
sure.
one day, like it'll be fine, right? And then I'm like, hey, idiots, like we need
Yeah.
to stop doing that. Um,
Yeah. That's what we're kind of at. Like, if it well, we're not trying, but at this point, it's like if it happens, it's what we know that that's the consequence. It's whatever. We'll deal with it. But yeah, if you're not in the like, oh, okay, if we do this, we know by having sex or consequences having a baby. We're not there right now. Then yeah, for sure, it's very a dicey
right. So,
feeling.
we talked, and we're like, kids are just not in the cards for us right now. There's still so much that we want to do.
Yeah,
Um,
of
so
course.
back to Google, and I'm like, okay, what are some hormone free birth control options? And literally the
Yeah,
copper IUD was like the only one. Um, and I put that
yeah,
off for a
yeah,
little longer because I'm like, the periods are supposed to be bad and my periods are bad anyways. And I'm like, I just don't know if I want to
yeah,
bleed heavier and more painful. And then just like one day I like sacked up. I'm like, okay, I just like got to do this. So I've been with the copper IUD for about 2 months now, and it's great. I don't
nice.
have those hormone side effects that I've had. I literally just feel like me, but with the
Oh, that's so
protection of an
wonderful.
IUD, which is great.
That helps
Oh
with
yeah.
your
So every
anxiety
time
too,
my
I'm sure.
period comes, I'm not like, oh my God, please come, please come.
Yeah, exactly. No, that's so good. And I think that's super important too. And that's what it's like, if you have to be in that certain place of your life, but I think if you can avoid the hormonal, if it's affecting you, if it's not affecting you, then fucking
Right. And like
right, doggy.
lucky.
But if it is, yeah, lucky. But if it is, or you're just not sure, ask the questions. There's other ways. Even though we were all brought up to think the pill and hormones are the only way to prevent pregnancy. And yeah, it is really easy for some people, you guys. It is really easy. Some people, my mom, super, super fertile. She can get, maybe not now, I don't know, but then yes. Me, not so much. A lot of
Mhm.
people I know, not so much.
Yeah.
Some people, not at all. So, I think the narrative that we grew up with, like, oh, just take a pill because anybody and a boy and girl look at each other, like, why wasn't it talked about? Like, I was just like, just take a pill and that's fine. Don't worry about the consequences. Like, why aren't we talking about more sex education, more cycle knowledge, more any of this? Like, why are we educating? If you're going to fucking talk about sex at that age, then educate properly, please, and not just condoms, STDs,
Exactly.
and birth control. Like,
Exactly.
let's talk about
Understand, like
actual
teach them that
reproductive
ovulation is
health.
like, this is high pregnancy time. So, you know, plan around that.
Yeah, no, totally, exactly. And I another unpopular opinion, people are probably going to hate me for this. I love sex. I don't want people to take this the wrong way. But when is it that you're going to die
Yeah.
if you don't have it? Why can't you just plan around it and not have it during a little bit of times, or try other things in the meantime? Like, no one's holding a gun to your head every time you're having sex and being like, oh, you have to have this. And it's just like,
Yeah.
oh, and you might get
I
pregnant.
mean,
Like,
like what? It's a 3 to 5 day
it's a really hard
window that you
choice.
have to come up with a different plan. Like they have things for that.
Yes, like, and there's other things you can do. There's fucking like oral sex. There's, if you want, I'm not gonna tell you what to do. Any of those things, or just not for a couple
Build up some
days.
anticipation on those days. Make
Like,
it fun.
yeah, or just like whatever. Like, am I the only one that gets tired after a 12-hour workday? I don't know. Like, sorry, but like, and it's true, like, we should be able to do those things, and for sure. But I'm saying, my point being is, if it's wrecking havoc on your life and it's hurting your body, and it's like you said, like for me too, same weight gain, it was always in my hormonal area, right under that. Like, yes, we have a uterus, so it could be there, I'm not saying that, but the difference when you're carrying weight there and you
Yes, it would
can't get
not
rid of it.
leave me alone.
no matter what I did, I was like, hey, eating's the same. I'm doing more cardio. I'm eating better. I'm training harder. I'm resting more. Like I'm doing all the things, but this bloat, and everyone's like, you look fine. And it was when I was on anxiety meds, and the combination of the two, I'm like, I'm not fine.
Like, I'm
I feel
telling you, it's not
bloated. I
normal.
feel, yes. And it's like, and but people are like, you look great. And now when I put comparison, they're like,
Right.
oh, I see what you're saying. And you're like, yeah, it's because these fucking medications were messing with my hormones for me, not everyone, but so anyways, point being, guys, if something's not right, like same with Hillary, she fights until she gets to the desired like medical attention that she needs. Unfortunately, you have to do that. You can't
No.
be a yes man if you don't feel that it's right, especially with your fucking hormones and your
Right. Like, I
fucking
kind of
fertility.
knew with the hormonal IUD, I was like, I don't want to do this. But it was kind of drilled into my brain. I was like my mid 20s, still finding my voice. But it was like drilled into me like, no, this is safe. This is the best option. This is right for you. And I'm like, I mean, you're the medical professional, I guess. But this time I was like, no, no fucking way. There's no way.
Yeah. And now you've been able to take something that you've had a negative past experience and find the positive by finding your voice and standing up. So now, like if you guys are struggling and you're not kind of like where necessarily where I'm at, where I'm just really okay with tracking it and being, I'm just, I like my body like used to reject even my earrings. So like it really worries me putting something inside me there. That's my personal reason why I haven't done that, or else that I would do the same thing. The copper IUD would be my next. And back in the day though, if I might be wrong, you were only able to get one, I think, if you had a miscarriage or abortion or pregnancy. It wasn't like just an option for birth control. You had to have, I think,
Hmm.
kind of like before I would get them, like a little bit before my time, you had to have some sort of surgery down there, labor, birth, something to be able to get the IUD. And now it's great that they're giving that more as an option because it's obviously positively impacting a lot of women that, need that option without
That's
having their
crazy
hormones
that an
fucked.
option would be kept from people to just make that choice. You have to go through this trauma to get a birth control option.
Yes. Yes, and it's insane. And like for me, I don't know about you, but I didn't have to go to the doctor. There was like a youth clinic that we would go to. And if you're 16, you didn't need a signature from your parents and they put you on hormonal
What?
birth control. And it's like, yeah, they were health nurses, so they could give you birth control. And we all went to the clinic and it was good. Like it was great in that sense. But then it was also like, I wish there would have been more discussion
Yeah,
about
I
the
mean,
effects
good
of
for
it and
preventing
how
teen pregnancy,
it,
but also like you're giving these kids hormones.
yes, where's the like therapy with it or lessons or like information, because there's going to be side effects. There's no follow up in a
No.
couple months. Come back and let's see how you're feeling. Like, here, go have fun,
Yeah,
go have
you're not
sex,
gonna have a
now you're
baby
good.
now.
Okay, yeah, you're fine. So now how would you say, after going through all of your experiences with birth control, how do you feel about not non-hormonal but like hormonal birth control? Is it firm, like
Yeah, hard
hard no,
pass
never
forever. I'm
again?
never ever again.
Totally. I'm pretty much, I wouldn't see myself ever going back on it either. I could see myself maybe one day getting a copper IUD if I was just like really done with any sort of that experience possibly. But yeah, I'm on the same boat with you, and I'm thinking there's going to be a lot of women feeling the same way
Yeah.
as we
Yeah.
talk about this more and more. Is there anything else with your experience of birth control that you'd want to share with us today that we haven't missed? Anything, any other tidbits of information for girls going out there that might be in a similar
Yeah, I mean, I
situation, or
just would
guys,
really
I
like to
guess? You never.
emphasize, like, use your voice. If you think the hormones are not good for you, say so. And don't let anyone push it on you. There are other options,
Yeah,
so explore them.
totally. Yeah, and don't be, and like you said, don't be afraid to use your voice, and you just keep fighting until something works. And if birth control pills work for you and you find the right one, fucking right. Like all we want to do is people to find the best thing. We don't want people to suffer in silence thinking that they have to do a certain way because we were raised or society said or some doctor said, because there's lots of really good health professionals out there. There's tons, but they don't always line up with the same views of what's good for you. Or like you wouldn't go to a dentist
No,
to talk about your birth control pills. They're doctors, but they're not, so just because you go to a general doctor doesn't always mean that they have a lot of knowledge in that area. Go to an actual, female doctor, go to someone that is for reproductive health, or, in the specialty area, if your general doctor doesn't have the full understanding, especially, like, no offense, like, not saying males can't, but sometimes female doctors just have that
Agreed.
more understanding. They bleed more than guys do, so they
Agreed.
understand that a
The
little bit
doctor
better
that
sometimes.
finally gave me my copper IUD, she was very understanding. I told her I was having side effects and she was like, okay, perfect. Like, she obviously gave me the heads up, like, just so you know, your periods will most likely be worse. Are you okay with that? I was like, hell yeah. I'll take a week of hell to be
Yeah.
myself for the other, 3/4 of the month. So just find someone who will
Yeah, and
actually
I think we
listen.
can both.
And you can tell when someone's actually
Yes.
listening.
Yes, because immediately if they're going to push you back on more medication, then they're not. My doctor in Grand Prairie, I will say, she was amazing. She always gave me any prescription or supported me in any medication that I wanted, but she equally supported me not being on them. And after I miscarried, she was like, do you want me to, you're out, almost out. And I'm
Yeah.
like, I need a break. I just need my body to reset. And once it resets, I'll
Hmm.
decide in that moment if I need to. And I
Yeah.
just have never gone back now. And like you said, it's just so different without that mess of hormones messing with you. You can at least feel more connected to yourself. I always felt disconnected. And I remember when I was a teenager, I was so mad. And I remember a lot of girls would be like, oh, I'm so, like, angry, and like I just want to push people into traffic, or like, and
Like,
you're
what
just
is
like,
your
what?
deal?
Like, the fuck? Yeah. And then you're like, oh. And there's always birth control. And like some of these girls were on the shot. And that's why I was like, I am
No
not going to get the
way.
shot. That's how it's going to affect people. Like, and yeah, you're fair to be worried about that with, and it says, like, I know we didn't get a chance to send you guys our episode before we got to launch here, but there are side effects of the birth control pill that, like, that is a risk of it, is blood clots, and breast tenderness, headache, migraine, decreased libido, missed periods, mood swings, spotting, like all those things. It's like,
Exactly.
well,
When
then
you
why
can
even be
just
on it?
figure something else out.
Yeah. So thank you again so much, girl, for coming in and sharing. Second, not last, episode. And I'm really excited to see and catch back with you of how, in a couple months' time, even 6 months' time, to see how this copper IUD goes, as well for other people that are looking into an alternative and maybe are a little bit unsure. We can reassure them of how good you're doing, and we'll keep everyone updated on. We'll keep everyone updated on the IUD. That sounds like
No,
a
but
really
I'll keep
weird
you posted on how it goes.
pitch. Yeah, but I think what's exciting for us, and what we mean by that, is that if it's really successful, we really want to be able to push that out to show others, if this is causing havoc. Look, Hillary did it herself. She was on the pill, she was on the hormonal one, and now she's on the hormone-free one and living her best life, which is helping her anxiety, which is all other things. So if it has been continually successful and you are loving it, we really want to hear back about that, so we can encourage others to use that as
Exactly.
an option
Yes.
if they need be. Perfect. Well, thanks again, my love. And we are going to jump right into our third guest of the show. I just love how many guests we have. We just love bringing every perspective. And again, Hillary, thanks for
Sounds
coming,
good.
and
Thank
we'll see
you.
you soon.
Bye.